Hi, welcome to another discussion on the hospice program. Today we'll be discussing hospice eligibility, the dying process, and the procedure involved in admission to the hospice program. This presentation is brought to you by United Hospice, serving the Chicagoland, Kankakee, DeKalb, and Rockford areas. And by Etecon Healthcare Consulting, your partner in healthcare business formulation, operations, and compliance. Let us start now. What is hospice? Hospice care is a special kind of care that focuses on the quality of life for people who are experiencing an advanced, life-limiting illness and their caregivers. Hospice care provides compassionate care for people in the last phases of incurable disease so that they may live as fully and comfortably as possible. To recap about hospice philosophy. Imagine a quilt that's been lovingly crafted to provide warmth and comfort to someone in need. Each square represents a different aspect of care, stitched together to create a holistic and supportive environment. That's what hospice philosophy is all about, ensuring that every piece of the puzzle is in place to give patients and their families the best possible care during a difficult time. The hospice philosophy of care is built on 5 core principles. Let's take a closer look at each of them. First is patient-centered care. In hospice care, the focus is always on the patient. Their needs, desires, and goals take center stage, and care plans are tailored to meet their unique situation. It's like designing a custom-made garden, where every plant and landscape element is thoughtfully chosen to create a serene and beautiful sanctuary. Second is pain and symptom management. One of the primary goals of hospice care is to ensure patients experience as little discomfort as possible. This means managing pain and other symptoms through medication, therapies, and alternative treatments. Think of it as a gentle, warm embrace, easing physical pain and discomfort burdens. Third is emotional and spiritual support. Hospice care recognizes that the end of life is a deeply emotional and spiritual time for patients and their families. By providing counseling, spiritual guidance, fun activities, and other support services, hospice care helps patients and loved ones navigate this challenging journey. Fourth is the interdisciplinary team approach. Hospice care relies on a team of professionals from various hospice disciplines working together to address the diverse needs of the terminally ill and their families. This includes nurses, social workers, hospice chaplains, and volunteers working harmoniously. And lastly, is bereavement support. The grieving process doesn't end with the death of a loved one. Hospice care supports family members through bereavement counseling and other resources, helping them cope with their loss, find healing, and guide those left behind through the stormy waters of grief. Adopting the hospice philosophy of care can profoundly impact the lives of patients and their families. Some benefits include improved quality of life for the patient and family members or caregiver taking care of the patient. Reduced hospitalizations and emergency room visits by managing symptoms at the patient's current setting, and not adding further discomfort for both the patient and their loved ones. Increased feelings of support and understanding reduces anxiety on the patient as well as the family that are dealing with effects of terminal illness. Enhanced sense of dignity and control creates an atmosphere wherein the patient and family have the support to determine how they would deal with their unique situation, and knowing that there is a team of hospice professionals from various disciplines working together for the benefit of the patient and their loved ones. And ultimately, greater peace of mind for the hospice patients and loved ones. To get more information about the hospice philosophy, listed here are the following online resources for you to explore. These are just some of the hundreds of hospice literatures that you can find online. We will now explore frequently asked questions about who are eligible for hospice and how they can qualify. Hospice care is a service for people with serious illnesses who choose not to get, or continue, treatment to cure or control their illness. People may choose to enroll in hospice care if the treatment is unlikely to be effective or if continuing it has become too burdensome. Hospice aims to provide comfort and peace to help improve the quality of life for the person nearing death. It also helps family members cope with their loved one's illness and can also provide support to the family after the person dies, including help with grieving, sometimes called bereavement care.
Hospice is for patients with a life-limiting illness and a life expectancy of 6 months or less, as determined by their physician. It is available to people of all ages, regardless of their type of illness. According to the Social Security Act, it specifies that certification of terminal illness for hospice benefits shall be based on the clinical judgment of the hospice medical director or physician member of the interdisciplinary group, IDG, and the individual's attending physician, if he/she has one, regarding the normal course of the individual's illness. No one other than a medical doctor or doctor of osteopathy can certify or recertify a terminal illness. Predicting of life expectancy is not always exact. The fact that a beneficiary lives longer than expected in itself is not cause to terminate hospice benefits. Can a patient receive curative treatment while in hospice care? Generally, hospice care focuses on providing comfort and symptom management, rather than curative treatments. However, if a patient's condition improves, they can be discharged from hospice care and resume curative treatments if desired. How is hospice care paid for? Hospice care is typically covered by Medicare hospice benefit, Medicaid, and most private insurance plans. Many hospice programs also offer financial assistance for those who do not have insurance or cannot afford the cost of care. Where is hospice care provided? Hospice care can be provided in various settings, including the patient's home, a hospice facility, a nursing home, or a hospital. The location of care is determined by the patient's needs and preferences and the availability of resources. If you think that someone you know can benefit from hospice, please give United Hospice a call at 847-779-3989, and they will promptly get you in touch with a hospice professional to discuss their needs and how United Hospice can help them. Each person's journey to death is unique. Some people have a very gradual decline. Others will fade quickly. As death approaches, your role as a hospice professional is to be present, provide comfort, and reassure the patient and their loved one with soothing words and actions that help maintain their comfort and dignity. As a hospice professional, it is best to know what the common signs of decline and impending death of a hospice patient.
As the hospice patient approaches death, the usual pattern most likely will occur. 1 to 3 months before death, the hospice patient is likely to sleep or doze more, eat and drink less, withdraw from people and stop doing things they used to enjoy, talk less, but if they're a child, more. When the patient's decline continues to progress, at 1 to 2 weeks before death, the person may feel tired and drained all the time, so much that they don't leave their bed. They could have different sleep-wake patterns, little appetite and thirst, fewer and smaller bowel movements and less pee, more pain, changes in blood pressure, breathing, and heart rate, body temperature ups and downs that may leave their skin cool, warm, moist, or pale, congested breathing from the buildup in the back of their throat, confusion or seem to be in a daze. Per CMS conditions of participation. Hospice care is a benefit under the hospital insurance program. To be eligible to elect hospice care under Medicare, an individual must be entitled to Part A of Medicare and be certified as being terminally ill. An individual is considered to be terminally ill if the medical prognosis is that the individual's life expectancy is 6 months or less if the illness runs its normal course. Only care provided by, or under arrangements made by, a Medicare-certified hospice is covered under the Medicare hospice benefit. The hospice admits a patient only on the recommendation of the medical director in consultation with, or with input from, the patient's attending physician, if any. Hospice agencies vary in their hospice admission protocol. However, based on CMS compliance for hospice, the following procedure is usually adhered to. 1. After receiving a referral for hospice, referral, which is to be completed on the new referral inquiry form, is endorsed to the intake department for determination of eligibility. 2. Next, all referrals should come with a 1. Face sheet, 2. History and physical, 3. Medication profile, 4. Physician's notes and orders, 5. Nurse's progress notes, if available. Order must be read hospice to evaluate and treat. 3. Before starting admission, the hospice program must be discussed thoroughly with patients by the marketing/hospice liaison and the conversion team. Patients' rights and other pertinent information must be thoroughly discussed as well. Hospice consents must be signed prior to admission by conversion team. If an RN is requested to explain more on the clinical side, an RN will accompany the conversion team and admit the patient when they sign. 4. Importantly, RN admission must be done within 48 hours from the signing of hospice consent or notice of election, NOE. Admitting RN must complete admission and medication order form on EMR, signed and dated, and must fax/email to office. 5. The admitting RN must call the attending physician and/or the hospice medical director, informing them of the hospice admission and the hospice diagnosis used, and indicate on the admission note that the attending physician's and medical director's verbal order to admit to hospice were obtained. If the hospice referral does not have an attending physician, the hospice medical director's verbal order to admit to hospice will suffice. 6. Let your agency know about your admission report within 12 hours from admission, together with the accomplished admission and medication order completed and signed by admitting RN. This is to inform the hospice team that the 5-day window for initial assessments from the social worker, chaplain, bereavement coordinator, and volunteer coordinator have commenced and must be accomplished right away. 7. The admitting RN will document admission chart within 24 hours, so SW and chaplain are aware to complete their initial assessment within 5 days from admission. If the comprehensive assessments by RN, SW, chaplain, and bereavement are not completed within 5 days, the hospice agency cannot transmit the notice of election, NOE. The hospice agency will not be reimbursed by Medicare for services provided. And worst is the hospice agency will be deemed non-compliant. This is an LTAG during survey and/or will be an ADR for the agency. 8. As part of the comprehensive assessments for hospice admission are the individual assessments of the social worker, chaplain, bereavement coordinator, and volunteer coordinator. These assessments must be entered on the agency's EMR within the 5-day window from admission. So if the hospice professional went to assess on the 5th day, their assessment notes are due right away. 9. The volunteer coordinator must call patient's PCG/POA to discuss the need for a volunteer and determine if there is a need. If a need is identified, the volunteer coordinator will coordinate with the clinical team and RN, and they will assign field volunteers and discuss what will be the scope of their responsibilities. 10. The hospice clinical team must submit within 5 days or less from the start of care, or SOC, the notice of election or NOE through their EMR portal. Any delays in the submission of the NOE will result in non-payment by CMS for hospice services rendered by your agency. To put is simply, no NOE, no reimbursement. 8. One of the most important processes is for the hospice copy officer to submit the hospice item set or his report as soon as possible from any hospice admissions. This process can be done through the CMS portal under QIS. The hospice agency must have a delegated person who has access to QIS to submit his reports on a regular basis. Thank you very much for taking time to view this hospice topic on hospice. the dying process, and the hospice admission process. We do hope that we will be seeing you again on our future presentations about the hospice program. This presentation is brought to you by United Hospice, serving the Chicagoland, Kankakee, DeKalb and Rockford areas with excellent and compassionate hospice care to our clients. Please give United Hospice a call at 847-779-3989. And they will promptly get you in touch with a hospice professional to discuss their needs and how United Hospice can help them. This presentation is also made possible by Etecon Healthcare Consulting Incorporated, your partner in healthcare business formulation, operations, and compliance.